So let's make this really practical. Somebody's noticing mom is a little forgetful, dad's a little forgetful, I'm a little forgetful, whoever the person is. When should one go to their doctor, or maybe be referred to one with a, usually they're gatekeepers, they're the primary care doctor. When would someone, when would you recommend someone makes it to you for evaluation for possible dementia, the most common, which I believe is Alzheimer's?
Right. So this is a really interesting question that is, I have to give a different answer now than I would have given even just a few years ago.
Oh, some new
So
stuff. I like
let's
it.
start with the answer I would have given a few years ago.
Please.
The answer I would have given a few years ago is, first of all, anytime you're concerned, you should feel comfortable to go to your doctor and talk about the concern. That's never something you should avoid doing. But if you're my next door neighbor and we're over the fence and we're sharing information, doc,
fence,
you know,
right.
what do you think I should do about this?
Right.
I would probably say that if you're still functioning well, if you're able to make it through the day by hook or by crook, you're managing your finances, you're managing whatever your job commitments are, you're able to get groceries in a reasonable way, make mistakes here or there, but you're basically functioning okay, then probably that's not someone that needs to be assessed much.
Really?
Part of why I would say that is that there's very little we can do about any of this. All right. Most of the diseases that are going to cause cognitive decline, like Alzheimer's disease, are so firmly entrenched.
Ooh.
The momentum behind them is so much by the time you have symptoms that you're really coming in at the very end of the story. It's really too late to do anything.
So that was
point.
a few years ago. There wasn't that much we could do about it.
Now that's starting to at least be something we can question.
That's exciting.
So,
please tell me more.
So there are approximately 20 to 25 different medicines that are reaching a phase of development where they're close to the point where they can present data to the FDA. Saying
they're in phase 3.
They're in phase 3, about 25 or so. And the majority of these are what are called disease-modifying therapies. What do I mean by that? So if I'm getting older, and I'd rather not get older, and one of the ways people can tell I'm getting older is my hair grays. I suppose you could do a thing to dye the hair so it won't look gray.
Right.
But I'm not modifying the aging
It's still
process.
gray in there. Yeah.
I'm
You didn't
aging
stop
at the
the gray.
same rate. It's
You've
just harder
hidden
to
it.
tell, right?
Right.
And this is all we could do for some dementia patients. The medicines that existed would at most be able to mask the symptoms to frankly, a very slight degree. The cognitive neurology equivalent of dyeing gray hair. But most of those 25 or so drugs in phase 3 development, meaning they're close to the point where they can go to the FDA and say, we're ready to start selling this drug. Most of those are actually disease-modifying. Drugs that claim, at least, to change the actual process that is damaging the brain.
Very exciting.
If successful, what these drugs would mean, that it fundamentally changes what Alzheimer's disease is. So the best version of which, the best credible version of which, is that in the future, Alzheimer's disease may be a disease that you die with, not from.
Not from.
Right? So
Like
famously,
prostate cancer. You're right.
That's a good example.
Right,
I agree.
right.
So famously, about a year and a half ago now, so in June of 21, a drug was released with great fanfare, marketed as Aduhelm. The generic is aducanumab. And this was a drug approved by the FDA amidst a good deal of controversy. Many people have read about it. And this is a drug that clearly did modify some of the pathology of Alzheimer's disease. The tricky thing is, however, that it wasn't clear that patients were clinically better off for having modified that damage. There is a bit of controversy still as to exactly what is the underlying damage in Alzheimer's disease.
Right.
That issue aside, this drug clearly did modify that damage. It lessened it.
The plaques, the tangles.
Correct. Plaques.
Okay.
So the patients for whom this actually was done, and it in fact did help the plaques, the study could not come to a clear conclusion that symptoms were any better off for it. Now another drug has been under development, and data have been released, published in New England Journal of Medicine just last month, that show that not only did this other different drug affect the plaques, one of the pathology changes that occurs in Alzheimer's, but symptoms were benefited. In other words, what happened was patients who got that medicine had less brain damage, and although their symptoms continued and still worsened, it was at a markedly less rate, 27% less.
Wow, is this also a biological, an antibody?
It's an antibody-based medicine. That's right.
Biotech.
So the FDA is going to be asked to make a decision about whether to approve this drug under an expedited pathway next month in January. And there are maybe other mechanisms to get it approved later on in this next coming year. But again, there's another 20 or so drugs in various stages of development.
Very exciting.
The key thing with these drugs, getting back to your initial question, that person says, gosh, I think maybe I'm getting a little forgetful. The key thing with these drugs is the way they're working, the way at least we think they're working, only has a chance to help if we do it soon. In other
Before
words,
the disease progresses.
exactly. If we wait until enough damage is done to the brain, then stopping that damage, what good does it do to stop something that caused, past tense, that caused the brain damage, that has permanently removed your cognitive capacities to the degree they have? What good does it do to stop that damage now? I suppose you could argue it's good for your future because it may not worsen much more. But it'd be far better to identify these pathologies, these damages in the nervous system, and give a treatment like one of these new drugs. Give it so that you never get symptomatic.